In Fort Myers, Florida, we spoke with Dr. Robert Brueck about breast augmentation and discovered there's a difference between breast augmentation and a breast lift.
Sometimes women will come in and see me for breast augmentation, and then upon examination, the main problem is that their breasts hang, they sag, and the medical term we use is they're ptotic, and the noun is ptosis. Now, I think it's important to understand when a woman comes in that she understands what do we mean by ptosis. And the way we define it is where is the nipple in relationship to the inframammary fold. For example, if this is the nipple and this is the inframammary fold where the breast hits the chest wall, as long as the nipple is above the fold, she's okay. Then she might need an augmentation. If the nipple falls significantly down below the fold, then she needs to have what we call a mastopexy or a breast lift. And a mastopexy or breast lift is merely the removal of excess skin from the breast. So I say to women, ask yourself the question, why does my breast hang down so far? And the answer simply is, you have more skin relative to the volume of breast tissue. So most women, after they have a baby, they get what we call postpartum involution. The breast shrinks, gets smaller. Skin necessarily doesn't because it's been stretched out. So now the breast envelope sags, they have ptosis. I think you have to look at two things. Number one, you have to look at the degree of ptosis. Is it minimal or is it substantial? Number two, you have to ascertain if the woman would like to have a larger breast. And then number three, you have to look at the medical condition and the social habits of the individual. For example, if a woman is a smoker, you have to be extremely careful in doing a one-stage lift and augmentation because the complication rate is off the charts. So if somebody's a smoker, I routinely do it in 2 stages. And you have to be extremely careful. And the reason simply is this. When a woman smokes, blood vessels constrict, blood doesn't get to the area or to the wound, it doesn't heal, wound breaks down, you lose skin, can get infected, it can be a mess. So you have to be extremely careful. So the first thing is A, diagnose ptosis. 2, are your breasts big enough? Are you happy with the size? No, I want them bigger. And then you know that you have to do a lift and an augmentation. And then the remaining question is 1 stage or 2 stages. If a woman wants to be really full, like a D cup, then I tell them most definitely 2 stages. First stage, mastopexy lift. Second stage, 6 weeks later, 3 months later, do a formal augmentation.
We asked Dr. Brueck what are the reasons to consider this procedure.
I think the majority of women, and they admit it to me, it's part of their female mystique, part of their body image, and I always tell people it's not vanity. It's not vain to want to look your best. And when a woman goes ahead and has a shapely body and then loses part of her breast because of pregnancy or whatever, or in the case of a woman who loses a breast to mastectomy, restoring that self-image, that self-confidence, that feminine mystique, it's a wonderful thing. You can change somebody's life very, very dramatically in a very positive way. And it certainly is very gratifying and satisfying me to be able to do that for my patients.